Okay, picking up where we left off, and we're going to go right into the glands here. So coming up top, we have your parotid gland with your parotid duct. You have your submandibular gland with the duct. We have the sublingual gland, and you have multiple ducts there, as you can see. Okay, so looking at this axial, MRI T1, you can see the mandible here. You have your parotid gland, and here's your sternoclenoid mastoid muscle, so the SCM. Here's your mandible, and here's a piece of your SCM, your parotid gland, so you can see how it's a different density. So that's what we're looking for. So when you're doing lab, I'll say, what density is it? And that's your cue that that's the parotid gland. Okay, so this one is interesting. You can see within the fat, so this is a coronal T1, within the fat there's these little gray dots. These little gray dots are lymph nodes. We have lymph nodes all over the place. So coming down on the sides here, and it's wrapping around anteriorly from behind the ear, wrapping around to attach to the clavicle. This is your SCM. You see your parotid gland on either side. Now the thing that's interesting here is they're calling this the vallecula. Clearly that's not the vallecula, that's your vertebral artery, okay? So don't be fooled, this is wrong. This is your vertebral artery. And then your brachial plexus is coming out. We covered that a little bit last week. So here's your lateral mass of C1 and your dens there. So here's your clivus in C2. You have your internal jugular, here's your SCM and your parotid gland. So here's your tongue, and I want you to know your thyroid cartilage, your cricoid cartilage. Here's your SCM. You can see it coming in and attaching right there on the clavicle. And here's your thyroid gland. And infrahyoid muscle with your hyoid bone, there's a piece of it there. This is your submandibular gland right there, and you can tell that it looks different, right? Here's your mandible. So here's the mandible, here's your submandibular. Looking here, here's your submandibular gland and your SCM. I'm not so concerned about that there. And you have your glenoglossus muscle with your tongue and your submandibular gland with your SCM. This is kind of confusing, but we can break it down. So you have your common carotid artery coming down. Actually, it comes up off the arch, so not down, it goes up, right? The blood flow up to the brain. So here's your aortic arch. You have your left common carotid that comes up. Coming down, you have your internal jugular that goes into the venous system, right? And you have, I want you to know your parathyroid glands on your thyroid gland. You have your trachea. And here's your superior vena cava, and your jugulars are going to drain into that. Also your cricoid cartilage and your thyroid cartilage, and here up top is your hyoid bone. So looking at a CT reformatted image, if we start with the ramus of your mandible, oral pharynx here, epiglottis, arytenoid cartilage with your thyroid cartilage, and your cricoid right below that. Here's your thyroid gland on either side. Coming down, this is your internal jugular. Going into your superior vena cava. Laryngeal pharynx, there. So here's your thyroid gland right here. Looks like a pyramid on either side. So this is your left, this is your right. You have your trachea in the middle with your esophagus, and this is your left internal jugular. Right internal jugular, right common carotid. Here's your thyroid gland with your thyroid cartilage just on the inside of that, and your esophagus. Now, the thing I want you to notice here is just not necessarily that you know all the lymph nodes, but I'd like you to know that we have a lot of lymph nodes within our neck. So when we go to the doctor, what do? They feel our neck and make sure our lymph nodes are within normal size. So here's a sagittal image looking at the lymph nodes. Here's your SCM muscle right there, your submandibular gland. Your masseter muscle in your mandible. You've got your mastoid process with your odontoid, internal jugular with your internal carotid artery. I also want you to know your longus capitis muscle on either side. We're looking here at your medial pterygoid with your lateral pterygoid, I want you to know your parotid gland with your longest capitis muscle coming across. Your left vertebral with your right vertebral, and this is your splenius capitis. And it's hard to see on a CT the muscles, so I typically don't ask you the muscles on a CT. You have your internal jugular vein, internal carotid artery with your external carotid artery. So you got to look at your level to see where you're at. We're up high, so the internal carotid will be internal, whereas the external will be external. As we head down lower, you're going to notice that the external comes medial before it goes lateral. So here we have the, we're down lower, and you have your vertebral artery, and they labeled it properly, and your external carotid artery with your internal carotid artery, and there is your jugular vein, your internal jugular vein. This is your external out here. So they're right next to each other, and the jugular is on the lateral side, so the external's medial. So it comes in, and then it goes out. The one thing I want you to see here that's a little bit different, I want you to see that there's an anterior facial vein that I'd like you to make note of. There's also, you can see the internal carotid with the internal jugular, and it's actually turning right there. That's why you're seeing it elongated. Your glenoglossus muscle and your SCM. Looking here, parotid gland, this is your masseter muscle, this is your mandibular condyle, and here is the tip of your mandible, even though it doesn't look like that. So that is, sorry, that is coming off your maxilla. So coming around, here's your SCM. I want you to know the splenius cervicis, the splenius semispinalis capitis, and your trapezius is on the outside. That's the most important. Right there and right there is your vertebral artery. These are kind of merged together, so this is your internal jugular with your internal carotid. So these are easier to see for me, so this is MRI, but I'm also trained in MRI, so easier to see the vessels. So here's your glenoglossus muscle with your body of your mandible. Coming around, here's your SCM. Looking here, we have your internal carotid artery and your internal jugular vein, and then your vertebral arteries are showing nicely there as black holes. We have your vallecula here with your epiglottis, okay? So coming around here, the main thing is that the facial artery, there's an artery and a vein. Hard to tell the difference. If you just say facial, you know, take a guess based on the density of the internal carotid or the internal jugular, you'll be able to tell you if it's an artery or vein. There's an external jugular vein. So that right there is your external jugular. So you have your internal, or this is low, so we're down low. So we have your external carotid with your internal jugular with your internal common carotid, or internal carotid, not common. It's not common anymore, it's been bifurcated. So over here you have your internal jugular vein, we have your internal carotid and your external carotid artery. Looking here, the main thing is you have your vallecula with your epiglottis, and you can see your internal carotid artery with your internal jugular vein. And here's your external jugular vein on either side. Pretty good for the muscles too. So you have your trapezius, here's your semispinalis cervacis muscle, and then this one right here is your longus capitis. Okay, good for the arteries. This is, I'm not going to ask you that one. This is down low. This is a thyroid, so it's a thyroid artery. So here is your common carotid artery. It has not bifurcated yet, and your internal jugular. So here's your scalene muscles, your vertebral artery. It's hard to see because the same density as the bone. And then your muscles, which are kind of hard to see, but not too bad on this one. So we have your trapezius, your splenius capitis, your semispinalis capitis, and your semispinalis cervacis, and your levator is right here. This is your external jugular. Your sternoclenoid mastoid muscle and your submandibular gland is there. This is your anterior jugular vein. I know. If you label that the facial, I wouldn't be surprised. So out here is your external jugular, internal, and your common carotid. We're down pretty low. So coming around here, we have your retinoids. This is your thyroid cartilage. Remember, it's a V. And your vertebral artery. That's the main things I want you to see on this one. Let's see. Here's your common facial vein and your thyroid cartilage. It's not as predominant V, but it's still there. You have your cricoid cartilage. This is your esophagus is actually right here. What else do I want you to see? Internal jugular, common carotid, and your trapezius. And see how the muscles are all kind of going together? I wouldn't have you label that. You can see the levator scapulae right there, though. Your scalenes are hard to differentiate. So coming across, here's your right jugular vein, your right common carotid. So we're down pretty low. Here's your thyroid gland, the right lobe, and your thyroid cartilage within your trachea is there. And your esophagus is compressed, and here's your vertebral body with your spinal cord posteriorly. Your longest capitis muscles run along the body there. Your levator muscle and your trapezius coming out wide. Okay, so anterior jugular vein, here's your thyroid, here's your trachea, and you have your common carotid artery with your internal jugular vein. You have your middle scalene, so anterior, middle, and posterior scalene muscle with your trapezius and your levator. Those are the big ones. This is too much for you guys to memorize for this course, so it's good to just show you the lay of the land of how the muscles all come together. If you're visual and you need to see this, it's in there for you, along with this one here, so you can actually see your sternoclenoid mastoid muscle and where it's going and where it's attaching. So along with your hyoid muscles and everything else. Okay, so muscles at the back. We're going to cover these in the arm when we get down to the extremities. So here's your levator scapulae muscles and your rhomboids. This is your trapezius, so you can see it starts up high on the back of the skull, so the occipital predominance there, and here's your trapezius with your deltoid and your teres minor and major, so minor and major. The temporalis muscle, we have the masseter, masseter, there's two of them there, the buccinator, and we have the sternoclenoid mastoid. Here's the trapezius with the platysma muscle over the top. Okay, so looking at the venous system, it's on top, so the superior vena cava, so coming down, this is your internal jugular, this is your subclavian vein, left and right, and this is your right internal jugular, and it drains down into the heart. Coming around, here's your aortic arch, so you have the brachiocephalic coming off to your subclavian on the right, going to your common carotid. Your left common carotid comes straight off the aorta, and your left subclavian also. So kind of confusing picture, but this is your brachiocephalic artery coming off of your aorta on the right, and then it bifurcates, and it goes up to the right common carotid to the right subclavian, and then it comes up and it bifurcates to the internal external common carotid. So coming up here, this is your right, so this is the brachiocephalic down here into your right common carotid, bifurcates into the external and to the internal. This is your vertebral right here. So this is your subclavian on both sides. Better picture, so this is not labeled correctly. This is your right brachiocephalic to your right subclavian is over here. So this is coming up to your right common carotid to the bifurcation. So you can see how the external here comes medial and then goes to the lateral side. So there is a very small segment where it is medial to the internal common carotid. And you can see we call them the verts coming up. So last slide here. You have the arch, the right brachiocephalic to the right subclavian to the right common carotid bifurcates to the internal external. On the left common carotid comes right off the arch, and so does the left subclavian. So that's it for your soft tissue neck.